Hello, thank you for joining us today. This is the final live session honoring Maternal Health Awareness Week, hosted by the Greater Newark Healthcare Coalition's Women's Reproductive Health Clinical Advisory Group. Today's discussion will focus on community perspectives. My name is Jessica Ramos, and I am the nurse supervisor for the Partnership for Maternal and Child Health's Nurse Family Partnership Program. We are one of three evidence-based maternal home visitation models that we operate to support healthy pregnancy and new parenthood. I'm joined today by Stacy Dimberg, Northern New Jersey Count the Kicks Ambassador, and Joanna Montgomery from the Brick Education Network, and we will discuss community resources that support a healthy pregnancy. Welcome, Stacy and Joanna.
Thank you.
Okay, so Stacy and Joanna, can you please share with us a little information about your programs?
Sure. My name is Stacy Dimberg, and I am the ambassador for Count the Kicks, an evidence-based mom-focused stillbirth prevention campaign with the goal of educating expectant parents to track their baby's movements and to speak up if they've noticed a difference with their typical baby movement patterns.
And hello, my name is Joanna Montgomery. I am actually assistant director as well as a doula and a PCHW for South Ward Healthy Beginnings. And we provide a host of programs that support moms who are expecting and or who have small children from the age of 0 to 5. We provide full spectrum doula services and a variety of resources to our families. In addition, we also support teen moms in 3 high schools in the South Ward of Newark.
Awesome. So as we all know, pregnancy is a really intense time. It's filled with joy, but can also bring on fears and anxiety. Your body is undergoing so many changes and it's difficult to know what's normal. Joanna, what are some of the warning signs of pregnancy complications?
Thanks for asking. Some that I would like to highlight are headaches that won't go away or they start to worsen over time, vaginal bleeding or fluid leaking, severe swelling, redness, or pain in your legs and arms, which can be a sign of preeclampsia, unusual chest pain and rapid heartbeat, trouble breathing, and lastly, a decrease in kicks and or no movement at all.
Okay. Stacy, how does the kick count empower those who are pregnant?
Empowerment is such an important piece of this program. We want to give expectant parents the confidence to speak up if they notice a change in their baby's movements. Often baby movements, like Joanna mentioned, is one of the first indicators that something might be going wrong. Expectant parents should find their baby's typical movement patterns using our free app or a piece of paper. And it usually starts at 28 weeks, 26 weeks if you're high risk. And if there's a change in movement, it's imperative to speak up. Call your OB, go to your labor and delivery department, tell them something's not right. And too often, pregnant people don't speak up because of fear of that maybe they'll be a nuisance or they'll be thought of as crazy or just a negative connotation around it. But we have 100 baby saves on our website where parents have actually saved their children by speaking up and being empowered and saying something was wrong. So that's our main message, is empowerment.
Absolutely. Stacy, how do you spread awareness in your role as an ambassador?
So it started with hardship. In 2014, unfortunately, I lost my first child, my daughter, Ryan Ava, to stillbirth, preventable stillbirth. And I never knew the importance of counting kicks or tracking my baby's movement. And I try to share my story with anybody who will listen, multiple outlets, just to show the devastating effects that stillbirth really can have on an entire family. My daughter's upcoming birthday is actually January 30th. 9 years later, it still hurts real bad. And I don't mean to get emotional. There are approximately 23,500 babies born still in the US every year. And unfortunately, most of them are preventable, and they occur within the last weeks of pregnancy. I truly believe that if I had been given the correct education and the correct tools, maybe I would have been able to save my daughter's life. And that's something that I will live with forever. So it's up to the ambassadors of Count the Kicks nationwide to spread awareness, share education, and get to as many outlets as we can that serve pregnant people.
Absolutely. What a great cause. Joanna, can you talk a little bit about the role of the doula during pregnancy, and can their benefits, and how can their benefits, and how can the services benefit someone who is pregnant?
Absolutely. So doulas provide emotional, physical, and informational support to moms before, during, and after childbirth. We listen to the needs and the concerns of mothers, as well as advocate when necessary. When it comes to services and the benefits of them, moms are empowered to have a say in their delivery experience. Doulas help cut back on time spent laboring in the hospital, and we help reduce anxiety and stress in moms. In addition, it's also proven that doulas have lowered the rate of medical interventions, and that also includes cesarean sections.
Physicians may not readily talk about doulas during prenatal visits. How can someone access a doula, and are doulas covered by insurance?
So with my organization, Southward Healthy Beginnings, we actually go out and we look for moms. You'll be surprised how many do not know what a doula does, or that they may have access to a doula. We have a program called Family College. It's a free, fun, engaging, and educational program for families with children from 0 to 3 years old, or for moms who are pregnant. We have been able to reach many moms through this program. We canvass the streets and referrals from hospitals. And lastly, which I think is so much more important, is word of mouth. And currently, New Jersey is working on Medicaid and doulas being certified to get paid through Medicaid. But right now, private insurances is not many at this moment.
Well, it's wonderful to know that more families can access doula care. At the partnership, we are training community doulas in Paterson and in Newark through the community of caring. We often talk about how critical it is, right, to advocate for yourself, but we also have to talk about the importance of support. Through the Nurse Family Partnership, we help women and families find resources within their own community. We provide education and guidance, and because they are first-time moms, they have so many questions and need so much support. Stacy, can you talk about the importance of having a good support system during pregnancy and into new parenthood?
Absolutely. They say it takes a village to raise a child, and I 100% agree with that. But many times women have difficulty discussing maternal health struggles such as pregnancy loss, infertility, postpartum depression. Maybe we just fear being judged or being mom shamed by others. Maybe there's a sense of failure that we might have and guilt that's associated with those issues. But the truth is that we all face struggles within our lifetime. And it's normal to feel ashamed, hurt, or even broken at some time. I think that the more that we discuss our problems and our maternal health issues, the easier it's going to be to talk about it for women. And the easier it's going to be for women to ask for that help. I think society puts a lot of pressure on women and
Mhm.
moms, and they expect us to be this cookie cutter type of thing, but that's not what it is. And we need to lift each other up, educate each other, and support each other at all costs.
Absolutely. Joanna, pregnancy is the first step, but once you have a child, you may feel like you're alone. Many organizations, including yours, have programs that support the entire family. Tell us about these initiatives.
Absolutely. At Southward Healthy Beginnings, we provide our families with various supports. Our doula services are free to our families. We also have created support groups for moms who may be having trouble breastfeeding, who, like you said, feel alone and need additional support and don't know where to go. We provide them with various resources. But in addition to all of that, we also try to help with mental health issues. We have community health workers where families can take their entire family to discuss issues that are taking place. And we provide a host of resources through the help of 26 plus partners. In closing of that, we also provide financial assistance. We provide families with lift codes or bus cards when they need to visit a doctor. That way they're not missing any of those important visits. We also assist families with food, utilities, and housing issues.
Oh, that's amazing. Great support. And there's so many people that are in need of these services and just the support alone. Thank you. Thank you so much for everything that you also, Stacey, everything that you provide. So what advice, this question is for both ladies. What advice would you give to someone who is pregnant for the first time?
Stacey, you want to lead?
Sure. So firstly, I would tell them to go and download the Count the Kicks app and
Absolutely.
learn about the importance of fetal movement. In the third trimester of pregnancy, that's when we begin noticing the patterns of our child's fetal movement. But I would also tell them to trust your instincts, ask questions, access resources, become educated, and use your mom voice. Especially if you think that something is wrong, trust your instincts. You're your baby's best advocate, and nobody else can ever top that. So just remember that always. You are your baby's best advocate.
Absolutely.
And the only thing I have to add, because Stacey said it all, is that find yourself a doula. You'll be surprised the support that you can actually get from the help of a doula. You know, ask around, find someone who's a good fit for you.
And bereavement and doulas don't only just help with birthing, they help with afterwards, postpartum, and they even help with bereavement. I wish I knew that there was such thing as a bereavement doula during my loss. It would have been so helpful, but I didn't unfortunately know. So I have to agree with you, Joanna. Find yourself a doula.
Yes, I agree. I also didn't know that there were bereavement doulas available, when you go through a tragedy. So that is the best.
Yeah. And
Absolutely.
postpartum too. Postpartum, how many times do moms feel so lost? And just to have somebody to call and talk to about things is just, it's so important to have that ability to connect with somebody.
And
Exactly.
we can't leave out lactation consultants as well.
Yes. Like you said, right? It's a village. It takes a village. I think that we all provide, right? With my program, this home visitation, the doula program, counting your baby kicks, those are things that are so important and make such a value into these people's lives. And it's just amazing. It's just amazing, all the work. Thank you so much.
Thank
So,
you.
as we close out today's program, it's a good time to share that Connecting NJ, a program of Nurture NJ, can connect any person of reproductive age with free services like the ones we've discussed today and more. There's a Connecting NJ office in every county, and you can find your contact at connecting.nj.gov. Thank you for joining us today. If you miss any of the previous sessions, you can view the recording on the Greater Newark Healthcare Coalition and the partnership's social media pages. Joanna and Stacy, thank you for sharing your expertise today. It has been so nice speaking with you.
Thank you.
Thank you.